Tuberculosis is a disease caused by a bacterium called Mycobacterium tuberculosis. Mycobacterium tuberculosis is not classified as either gram-positive or gram-negative because it does not have the chemical characteristics of either. When a gram stain is performed on Mycobacterium tuberculosis cells, the cells do not often stain. Because of the lack of stain, the cells are often referred to as ghosts. Instead, the bacteria is classified as an acid-fast bacteria, which can be stained using the Ziehl-Neelsen stain. When this method is used, the acid-fast bacteria will appear pink. The bacteria is a long, thin, and rod-shaped, which classifies it as a bacillus. It is also immotile, which means that it does not produce self-propelled motion. The cells contain special high content of lipid cell walls that contain mycolic acid, cord factor, and wax-D. Mycolic acid helps protect the bacteria. Cord factor is a glycolipid molecule found in the cell wall. It is the primary lipid found on the exterior of the cells. Wax-D also gives the cell an even larger concentration of lipids. Humans are the ultimate reservoir or host that serves as a source of infection for Mycobacterium tuberculosis. However, animals can occasionally be infected by exposure to a person who is shedding the organism.
So now that we know what tuberculosis is, I would just like to talk about some of the signs and symptoms and how to recognize tuberculosis. According to the CDC and Mayo Clinic, which had very similar signs and symptoms, the following are signs and symptoms of active tuberculosis. A cough that lasts 3 or more weeks, coughing up blood, chest pain or pain when breathing or coughing, unintentional weight loss or loss of appetite, which ties to that, fatigue, so you're very tired throughout the day, fever and night sweats kind of go together, as well as chills. So tuberculosis can also affect other areas of your body, including kidney, spine, or brain. When TB occurs outside of the lungs, the signs and symptoms vary just depending on which organ is involved. For example, if there's tuberculosis of the spine, it may cause back pain, or of the brain, it may cause headaches, and of the kidney, it may cause blood in the urine. And you would not see these things if it was tuberculosis of the lungs. So I think a common question or an important thing to know would be, at what point should I be treated or what point should I be seen by a doctor? And according to Mayo Clinic, if you have a fever, unexplained weight loss, you're drenching at night in sweat, or you have a persistent cough, these are signs of tuberculosis that can also result in other medical problems. So you want to go see the doctor for those things, so you can be tested and they can determine the cause. Coughing up blood would be one as well that you would want to be treated for immediately, and so they can figure out what's going on. So the Center for Disease Control and Prevention recommends that people who are at an increased risk for tuberculosis be screened for latent TB infections. This recommendation includes people who may have HIV or AIDS, people who are IV drug users, people who are in close contact with infected individuals, or if you visit an area with a high risk for tuberculosis, and healthcare workers who treat people with a high risk of tuberculosis. I think it's very common that if you work in a healthcare area that you are tested for tuberculosis at least once a year. I know I have to do that for my job, and I think it's a good thing to be tested because we do come in contact with people who have active tuberculosis. So signs and symptoms vary, again, depending on which body part is infected. However, if you have latent TB, you don't feel sick, you usually don't have any signs or symptoms, or sometimes you have a few of them, and you can't spread tuberculosis to others. So it is important to be tested or screened for latent tuberculosis. So now that we know about some of the signs and symptoms and when to be seen by a doctor, I'd like to just talk about transmission and how tuberculosis can be spread. So, as I'm sure was mentioned before, tuberculosis is a bacteria disease that is spread through the air from person to person. The TB bacteria is put into the air when a person with TB of the lungs or throat coughs, sneezes, speaks, or sings. If people walk by or if they're nearby, breathe in this bacteria, they can then become infected. I think it's common that people think that TB can be spread through shaking someone's hand, sharing food or drink, touching bed linens or toilet seats of one who's been infected with TB, sharing toothbrushes, or kissing. However, these things are all not ways that tuberculosis is spread. However, if you are close enough to be kissing someone, it's common that if they cough or sneeze that you could then pick up the TB bacteria. So although tuberculosis is contagious, it's not easy to catch. You're more likely to get tuberculosis from someone you live with or work for instance in a hospital if you're treating a patient with TB. You're more likely to get it from these people than you are just from a stranger on the street. Most people with active TB who have had appropriate drug treatment for the last 2 weeks are no longer considered contagious. So if you do come in contact with someone who is being treated for their tuberculosis and have been for the last 2 weeks, it's not common that they would spread tuberculosis to you. So that's all I have on signs and symptoms and transmissions. Thank you.
So tuberculosis is a curable disease. Both active and latent tuberculosis can be cured. Just as a reminder, latent tuberculosis is when someone is infected with the inactive form of the bacteria but does not show signs or symptoms. Active tuberculosis, on the other hand, is when the active bacteria is causing all of the signs and symptoms. Depending on which type of tuberculosis a person has, treatment can be a little bit different. Because latent tuberculosis is inactive, it is a much easier process to get rid of. Either way, there is a very strict regimen of antibiotic drugs that must be followed to cure tuberculosis. This strict regimen can last from 4 to 9 months. The first-line drugs that are currently approved by the FDA for treating TB include isoniazid, rifampicin, rifabutine, rifapentine, pyrazinamide, and ethambutol. There are many factors that determine what regimen is best for each person, such, for example, age would be a big one, and whether other diseases are currently present in the body. These regimens will be discussed in the next few slides. However, as a note, it is very important that people who have tuberculosis finish the medicine, taking the drugs exactly as prescribed by the doctor. If they stop taking the drugs too soon, they can become sick again. If they do not take the drugs correctly, the tuberculosis bacteria that are still alive may become resistant to those drugs. And tuberculosis that is resistant to drugs is a much harder and more expensive thing to treat. If resistance is developed, second-line antibiotics must be administered through a continuation phase that can last up to 18 weeks. So this chart shows some regimens that may be prescribed for doctors depending on the person who has tuberculosis. So if you look at the top left box, this shows what the preferred regimen is for someone who is going through the initial phase of the antibiotics. So this is so they would want to take a daily dose of these 5 antibiotics for 8 weeks. And underneath the box, it shows a continuation phase. And that is what they will have to take if they do not follow the initial phase and the bacteria becomes resistant to these first-line antibiotics. This table right here is the regimens for someone who has latent tuberculosis, which is the tuberculosis that it does not show any signs or symptoms. So there is only one vaccine that exists in the prevention of tuberculosis. This vaccine is called the Bacillus-Calmette-Guerin vaccine. It is a live attenuated vaccine, which means it contains live microbes whose virulence has been lessened. It was developed in 1919 by Albert Calmette and Camille Guerin. It is not commonly distributed in the United States because of the low risk of infection to the Mycobacterium tuberculosis bacteria. It is, however, still used in many places in the world where tuberculosis is more prevalent. It's usually shown on the upper arm. There's usually a scar. I don't know if many of you have traveled outside the country or noticed in people that aren't from the United States. Usually a lot of the people will have the scar from this vaccine on their upper arm. So something cool about tuberculosis is that it has existed for up to 500,000 years. Although most scientists believe tuberculosis emerged only several thousand years ago, in 2007, new evidence of the disease was found in a 500,000-year-old human fossil from Turkey. Throughout the centuries, it has been called many different names, such as King's Evil, Captain of All Men of Death, and many others. In this picture, there is a view of the inside of a plaster cast of the skull of the newly discovered young male from Western Turkey. The stylus points to tiny lesions in size found along the rim of bone just behind the right eye orbit. The lesions were formed by a type of tuberculosis that infects the brain and at 500,000 years in age represents the most ancient case of tuberculosis known in humans. And just some more information, some statistics to show just how big of a epidemic tuberculosis is. There are some statistics. Tuberculosis is the second only to HIV/AIDS as the greatest killer worldwide due to a single infectious agent. In 2013, 9 million people fell ill with tuberculosis and 1.5 million died from the disease. Over 95% of tuberculosis deaths occur in low and middle income countries, and it is among the top 5 causes of death for women aged 15 to 44. In 2013, an estimated 550,000 children became ill with tuberculosis, and 80,000 HIV-negative children died of TB. TB is a leading killer of HIV-positive people, causing 1/4 of all HIV-related deaths. Globally, in 2013, an estimated 480,000 people developed multi-drug resistant tuberculosis. The estimated number of people falling ill with tuberculosis each year is declining, although very slowly, which means that the world is on track to achieve the Millennium Development Goal to reverse the spread of tuberculosis by 2015. The tuberculosis death rate dropped 45% between 1990 and 2013, and an estimated 37 million lives were saved through tuberculosis diagnosis and treatment between 2000 and 2013.